Okay, as you think about heading back to work tomorrow, are you dreading it? Is it more than dread? Maybe depression, burnout? Well, it's an important conversation to have as we focus on mental health for National Suicide Prevention Week.
Dr. Robert Shulman, he is chair of the psychiatry department at Rush University Medical Center, joins us now to discuss these issues. Dr. Shulman, thank you for being here on this Labor Day. We appreciate your time.
My pleasure. Thank you.
All right, so we all deal in our jobs with a certain amount of stress, but are more people indeed suffering these days with more mental health issues and burnout when it comes to their jobs?
I don't know if more are suffering it, but certainly plenty are. I think that more people are suffering from burnout and depression just from basic societal stress these days. I think there's a higher level of stress going on, across the nation, and it's not just work related. But there is a difference between the two, and I want to make this distinction between burnout and depression because there really is a difference. Burnout is characterized by emotional exhaustion. It's a triad of symptoms: emotional exhaustion, a feeling of being really inefficient at work, and this sort of depersonalization where one is emotionally detached from whatever's going on. It's just sort of a numbness. So emotional exhaustion, the numbness, and a feeling of inefficiency is sometimes associated with this. There's this sort of moral debate going on in one's head: is am I doing the right thing? Do I belong here? Depression, which may follow burnout or be associated with burnout, is a distinctly different condition where it's a clinical syndrome characterized by symptom clusters such as a depressed or sad, anxious mood, irritable mood, so mood changes. There can be vegetative or physical signs such as changes in sleep or appetite or energy or motivation or loss of interest and unable to feel pleasure and joy, those sorts of things. And also a sense of helplessness or worthlessness, sometimes guilt or shame. And lastly, one can develop a real profound depressive syndrome where there could be thoughts of suicide or a sense that, one doesn't belong here anymore.
You mentioned it's not just work adding to the stress. I mean, we've had a heck of a few years, right? With COVID adding to our stress in so many ways, from work to home, being a parent, things like that. If you are thinking burnout may sound familiar as you were describing it, are there things you can do?
Well, certainly things you could do. And it's not just, again, work. I think that one can burn out from work. I think one tends to burn out from work when other aspects of one's life are not functioning very well. So I think the things you can do is really concentrate on when you're not at work. How do you turn it off? How do you de-stress? How do you go home and sort of work through one's day, one's problems, so that if you maintain more of a healthy lifestyle with exercise, daily exercise, or some exercise, even a 20-minute walk per day has benefits, neuropsychiatric benefits for the individual. Do the eat right, sleep right, the usual kinds of healthy lifestyle such, your chances of burnout are going to be less. The things you could do at work, perhaps if there is stress that is contributing, or chronic stress that's contributing to a sense of detachment and leading to burnout, is you have to address it. You have to talk to somebody. You have to go to your supervisor and say, hey, the workload is such that I'm beginning to have a hard time with it.
Good advice there. Now, Dr. Shulman, before we let you go, we only have a couple seconds left, but is there a rule of thumb to know if you can do things on your own versus needing some professional help?
Well, it's a good question, when to ask for help. I think that if one has experienced depression, or especially if you see changes in coworkers, families, or friends, where there's more of a withdrawal and less of an interaction, where one really looks as though that they're suffering or sad all the time, I mean, that's when you have to reach out. If you notice that in yourself, where you're just unable to feel joy or feeling depressed, or if you start having intrusive thoughts of dark, bad things, that's certainly a time to reach out. There's the suicide hotline. There's also your primary care doctor that can give you a referral. Access is difficult, but doesn't mean you don't try.
Exactly. Dr. Shulman from Rush, thank you for being here for this important conversation.
Thank you for having me.